Welcome back, Surgery Kid! In this video, we will discuss how to prevent and correct dog ears in your wound closures. In a surgical wound wherein one wound edge is longer than the other, the way to prevent dog ears from being created is an equal suture spacing. You can place sutures on the longer wound edge with longer intervals than the opposite edge. This will compensate for the extra length and will lead to good wound approximation. When dog ears are created, especially in patients with thick skin, there are multiple ways to correct it. The first one is to resect an elliptical incision around the dog ear, as you can see with these broken lines. This elliptical incision will remove the extra skin, and closure can be done in a normal, linear direction. Depending on the size of the dog ear and elliptical incision made, the incision can also be closed in a curvy linear direction, as seen in this image. This will facilitate wound apposition throughout the wound length. If the dog ear is only pronounced on one wound edge, an L closure is indicated for correction. The dog ear is incised on the center to form two triangular-shaped skin flaps. The ventral flap here is completely excised, and the other triangular skin flap covers the wound. This is closed with the same suture pattern used for the original wound. The L closure can also be used if the dog ear is seen in both wound edges, as seen in image 1. The dog ear is incised in the middle as if the original surgical incision is extended. This will result to two skin flaps. Both are completely excised, and the wound is apposed in the same way as the entire wound length. This method can be seen as lengthening the original wound and removing the extra skin that made up the dog ear.